Welcome to Politics Done Right. My name is Egberto Willies, your host. Good morning, Houston. Good morning, Harris County. Good morning to Texas. Good morning to the great United States of America. Good morning to every nook and cranny that gets our 100,000 watt signals that we try our best to make sure permeate the entire area. Good morning to the rest of the world. We are having a few little techies right now, but we are still bringing you a great show, folks. How are my peeps doing? I trust all are ready for the eclipse. I'm not sure if we are going to be able to see it here in Houston, but you know what? At least we think it's going to get a little bit darker. I mean, with 94% coverage, that's still a lot of sunlight that comes through. And I remember before an eclipse, when you still got a piece of the sun, it's still quite a bit of the sun that you get. Anyway, let's see if we have connectivity. Yes, are my favorite geniuses in the studio connected? How are we doing, my folks?
Well, we're still looking for them at this moment. The listener will never know that there's a problem here because it's internal with the talkback between us and you. So fortunately, we don't really need that right now because we're able to talk to you and we're able to text. But I'm still trying to figure out what in the world is wrong here. But it could take me a while, and I don't understand quite exactly what's going on. But we're going to blame it on the prison show. Because,
well, you know what?
Every time the weekend ends, and the prison show's been on, something is wrong here. So let's blame it on them.
Yeah, well, there are so many buttons to push, and when you leave your domain, my friend, who knows what kind of buttons people push and leave it out of sync. But you know what? That's why you are there, man. The man's in the house. The man's in the house. How's Brother Jack doing?
I'm doing very well, Egberto. I don't have anything to read this morning because I was kind of concerned with this. So,
well, that's okay. We are going to miss your wisdom for a little temporary time here, but you know what? We're still moving forward. Anyhow, folks, are you guys ready for the eclipse?
Oh yeah.
Yep, I got my my hot dogs and whatever. I don't know, man. I'm trying to figure this stuff out on the fly.
Okay, well, look, let me let you guys figure that on the fly as we go with the program that we have today, folks. It's going to be a great program, and I want you to listen attentively. Because, we always talk about the mainstream media, and there's one thing I always talk about, and I say there are a lot of great reporters out there. And the truth of the matter is, yes, the New York Times, the Washington Post, and all these rags have great reporters. Unfortunately, they also have these people called producers and editors, etc., who ultimately are the gatekeepers. And every so often, the right information gets put out there, or information that we would want to be out there gets out there. What happens too often is that it doesn't get the kind of coverage that you would want it to get covered. But when I saw this story, the first thing that I thought of is, you know what's interesting? This story is a great story. This story, it's great that a reporter at the New York Times did it, but I bet I won't see any more coverage other than a great reporter write a great article. And in this case, let me give the name. His name is Chris Hamby, the reporter who reported this. It gets the coverage. It gets a whole very lengthy story in the Times. The big news radio shows may pick it up one here and there, but then it's all forgotten. But the problem then persists. The media can say we reported it, and then it's all over, and people stay in the same state that they were in. All right. So with that initiation, Let me give you the name of the title of the story in the New York Times was Insurers Reap Hidden Fees by Slashing Payments. You may get the bill. That's the title of the article. And when I saw the title of the article, I said, you know what's interesting? That article says something that everybody kind of knows, everybody kind of feel, but it should have been different. It should have been yet another insurance scam that leaves the bill ultimately with you. Do something about it, people. Raise hell about it. Yeah, long title. But that's what the title should have been. And I'm going to start the article with a simple, with the way they started. It says, weeks after undergoing heart surgery, Gail Lawson found herself back in an operating room. Her incision wasn't healing and infection was spreading. At a hospital in Ridgewood, New Jersey, Dr. Sidney Rabinowitz performed a complex hours-long procedure to repair tissue and close the wound. While recuperating, Miss Lawson phoned the doctor's office. In a panic, he returned the call himself and squeezed her in for an appointment the next day. He was just so good with me, so patient, so kind, she said. But the doctor was not in her insurance plan's network of providers, leaving his bill open to negotiations by her insurer. Once back on her feet, Miss Lawson received a letter from the insurer, United Healthcare, advising that Dr. Rabinowitz would be paid $5,449.27, a small fraction of what he had billed the insurance company. That left Miss Lawson, hear this now. Hear this. This is how we talk about transfer of wealth from all of us to the few. After the insurance company and the employer and the doctor did all their magic, this woman who pays for insurance, she was left with a bill of $100,000. I'm thinking to myself, but this is why I had insurance, said Miss Lawson, who was fighting United Healthcare over the balance. They take out, what, $300-400 a month? Well, why aren't you paying these bills? The answer is a little-known data analytics firm called Multiplan. Let me stop from the article and explain a few things with you right now. There are companies that just pop up, right? You may have been working in the office at a doctor's office and say, hey, man, there's a way that we can actually create a business model that we can save the insurer money, we can save the employer money, and we can stiff the doctor. And after we stiff the doctor or the hospital or whatever, the person who ultimately gets held on to the bill is the patient. Remember, ultimately, the patient always ends up with the bill. You go to the hospital, you're sick, you're hurt, and you're in pain. You want a cure, you want something done. And then, as you're in the emergency room, and this just happened with my wife, as remember, she had what we thought was a stroke, but it was a palsy from shingles, and she was very, very sick since she got shingles with lupus. And, you know, as I went through the process, I am seething because I'm seeing good doctors, good nurses, and everything else. But who comes into the room as her head's banging, as she's in pain? And this happens to everybody who goes to an emergency room, who goes to a hospital, etc. Here comes the business office. She can barely see, she can barely talk from the pain, and they're asking, who's your insurer? How much is XYZ? What's your plan? And there's a whole litany of questions on how this bill that is yet gonna be that is yet being given, how it's gonna be paid, and then you're asked to sign a thing that says, well, by the way, if the insurance doesn't pay the bill that we are going to charge you here at the hospital, you're signing away ultimately that you will pay. And in other words, you're extorted at that point, right? You are not going to not sign something when you're there with a stroke, when you're there with a pain or whatever. You're going to sign that bill. I mean, you're going to sign that promise that says, no matter what the hell you guys charge and what the hell the insurance doesn't pay, I'm going to pay it. Hell, my head hurts. My body hurts. I need your care. You sign it. You sign it. So this company, the answer is a little known data analytics company now called Multiplan. Notice what they call themselves, a data analytics company. They have nothing to do with healthcare. They know nothing about your condition. All they do is look at the numbers. So let me continue with the article now. It works with United Healthcare. They work with United Healthcare, Cigna, Aetna, and other big insurers to decide how much so-called out-of-network medical providers should be paid. It promises to help contain medical costs using fair and independent analysis. But a New York Times investigation based on interviews and confidential documents show that Multiplan, another parasite, and the insurance companies have a large and mostly hidden financial incentive to cut those reimbursements as much as possible, even if it means saddling patients with large bills. The formula for Multiplan and insurance companies is simple. The smaller the reimbursement, I repeat, the smaller the reimbursement, the larger their fee. In other words, they make more money by telling the employer and insurer to pay less to the provider, meaning the hospital or doctor. And since you have already signed away your life with the hospital or the doctor, when that insurer pays less to the doctor or the hospital, guess who promised to pay that bill? You did. Because before any one of these people give you any service, they make you sign a statement that says, if the insurance doesn't pay, you will pay. And Multiplan, the parasite in the middle, says, hey guys, I'm going to show you how you don't have to pay the doctor, and I'm going to show you how you don't have to pay the hospital. And by the way, the amount that I save you, right? I am going to make a percentage of the amount of money that I save you. So what's your incentive as Multiplan, that parasitic company? You try like hell to not pay the hospital or the doctor, irrespective of whether it's justified or not, because you make a percentage of the saving. You don't make a fee that says, I'm going to hire this company to take your business from you. You make a percentage of the fee. And why do employers like that? Because, employers usually are the ones who pay the bill, and the insurance companies just administer it for the employer. So the employer wants to reduce the cost, and they are willing to just say, okay, I'll give you a percentage of what's saved. If it were a real business, it would say, my service to you is to look over the records to make sure you're not being overcharged. But no, they make a percentage of what they save you. That's what called legal fraud. That's what called parasitic behavior. They provide no real services, right? But a New York investigation based on interviews and confidential documents show that multi-plan and insurance companies have a large and mostly hidden financial incentive to cut those reimbursements as much as possible, even if it means saddling patients with large bills. The formula for multi-plan and the insurance companies is simple. The smaller the reimbursement, the larger their fee. Remember, it's a percentage. Here's how it works. The most common way Americans get health coverage is through employers that self-fund, meaning the employer pays for their workers' medical care with their own money. The employer collects a fee from every single employee. Like we may pay, let's say, $1,000 a month for health insurance, and the insurer may have, I don't know, let's say 10,000 employees. So they are collecting $10 million a month from all the employees. And then they pay an insurance company to administer insurance for, whenever bills come up, etc., with the doctors, the hospitals, etc. Instead of them hiring an insurance company and paying an insurance company fee, the employer takes on the risk of collecting the money, holding the money, and then they pay a small fee to the insurance companies just to administer insurance that they are funding. Another ridiculous setup, but that's what it works. That's how it works with a lot of big employers. All right. The employers contract with insurance companies to administer the plans and process claims. Most medical visits are with providers in a plan's network with rates that are set in advance. All right. So the employer and these providers usually have rates, but there are times that you get out of network service. And let me tell you how that can happen. No fault of the person that's there. You go into a hospital and you have a problem. Like, as an example, my wife went into the hospital. She has lupus and she got meningitis. She went to the hospital in her plan, in the district's plan. She went to that hospital. So that's taken care of. Bingo. But within that hospital, there are doctors. And not every single doctor that's going to see you, because a doctor may be off or whatever, they may see you. So she had to see while in the hospital, she saw a neurologist, she saw a nephrologist, she saw a general practitioner, she saw what's the doctor that takes care of lupus, the one who takes care of things like arthritis and so forth. She saw one of those doctors. Now, they were all very nice. They stuck their heads in there for about maximum was the longest doctor spent about 15 minutes in there. And that is only one day they spent that time. Normally they come in with their phone. With the first time that one of them came in with the phone, they looked at the phone and they had her name, rheumatologist. Thank you, Alistair. They look at their phone and it was they had the wrong patient. And then I said, no, that's not her. And by the way, that's why you need an advocate in the hospital. I'm like, that's not her. It's she is. And then he said, oh, yeah, your test came back XYZ. And he started telling her these things. And he never touched her. He never used his stethoscope, even though it was around his neck, to check her heart rate, anything. So most of them came in, said a few words, and left. Okay. Some of them, before they left, I queried them and made sure that they answered a few questions. And, so the way most of them dealt with her was to look at they take blood every day, look at the results of blood work, etc., ask her a few questions and walk out of there. 5 minutes, if that much. Right. And my wife would say things like, they were so nice. Yeah. I'm like, yeah, but that's cha-ching. Every doctor that opened that door looked at you. That was cha-ching, meaning, $400, $500, $600 that would be charged as soon as they saw you. And, I'm sitting down there with a little smile on my face and what a healthcare system. What a healthcare system. So now the thing is, some of those doctors will be taken care of immediately. A lot of times those doctors are not even sure if the person that they're seeing in that hospital happens to be on the network that they're in. So they come and they do their job and they see the patient, and then they go ahead and they issue the bill. And maybe they're in the network, maybe they're not. But if they're not in the network, right, and the insurance company pays them a piece of that bill, they're then coming to you for paying that rest of that bill, which is what happened to this woman here, who they paid the doctor $5,000, which would have been a contracted rate maybe for somebody in the plan. And then that doctor, the difference was his bill was really $105,000. I don't know why it was that high, but it was $105,000. And then the patient got stuck with $100,000. $100,000. And that doctor has the choice then of coming to that patient with the bill. And then after coming to that patient with the bill, if that patient doesn't pay, from a legal standpoint, they may not do it, but they could. That doctor is coming after that person's house, that person's car. They are going to bankrupt them. That is what happens most bankruptcies in the United States. The doctors, the hospitals, they all come after you for non-payment, and then you're responsible. Look, right now as it is, a few months ago, my wife had a biopsy. Some of you have heard this already. And, the bill came in the mail, and she passed it on to me and she says, check this out. And I looked at it and it was so large, I could do nothing but smile. Actually, I laughed. A biopsy, she was in that hospital for 1 minute. For 4 hours. We got there at 8 o'clock. We left there at noon. They did a needle biopsy. They sat her in a room, in that emergency room, for those hours to make sure she wasn't going to bleed out. And we left. The bill came. It was $27,000. $27,000. And the insurance company, then the hospital sent another bill saying, of that $27,000 insurance company paid most, you're responsible for $3,000. I told my wife we're not paying that $3,000. I am going to make a national issue out of this entire case. I am going to blog it. We haven't resolved it yet, but if it's not resolved, I am going to blog, write, and take it everywhere else. And, we know there are more bills coming because, again, she was in the hospital twice since then because of shingles/lupus complications. But there are these companies now, they provide no service. They provide no health care. They simply look at numbers, pieces of paper, and they tell an insurance, don't pay this bill. They tell an employer, don't pay this bill. And because they tell the employer not to pay a bill, and the employer does not pay the bill, they then get a big chunk of money from a percentage of that bill from the employer and from the insurer. But it goes deeper than that. It is so bad that this company, Multiplan, several times make more money from that non-payment than the provider itself, meaning than the hospital gets from the insurer or than the doctor gets from the insurer. If you can't tell me there is something wrong with our healthcare system, and for all of you who are indoctrinated and so scared when we talk about a single payer system and getting the private insurance companies out of the market and getting employers out of insurance, because somehow you think your freedom is going away. I'm telling you, most people are not sick at one time, but at some time you will get sick. And when you get sick, the vultures are coming. And you may think you have great insurance until one hospital, until one doctor somehow gets around the plan that you have and gets you stuck with the bill. Because remember, all these guys have pricing power and they want to be paid. And the only victim, the only one without pricing power, the only one that can be taken advantage of ultimately is you, the patient. I'm going to take Dr. John's call and then we'll continue this because all of us need you guys to wake up and grow up and get off the bandwagon that these corporations have indoctrinated your minds into. Let's go to Dr. John and then we'll continue. Brother Dr. John, come on in.
Hey, Egberto. Yeah, a perfect subject for me. Listen, single payer healthcare is long, long, long overdue. But how do we get from point A to point B? I mean, gosh, we've been talking about this since, oh man,
a long time,
longer than I've been alive. So,
all right, first of all, you're the doctor. First of all, so let me ask you one question because we have a solution. When I say we, I'm talking about a lot of us activists who've been working on Medicare for All for a long time. Since we know it's not going on the national level, there's something that we have to do. But before I talk about that, I want to ask you, do you have something that you've thought about before?
Yeah, well, you and I talked about it a little bit. There should be a public option. I'm not into mandates for, I think, I believe in the individuals' right and privilege to choose. Now, if they have an employer-based deal and they're happy with it, then God bless you. But there should be a public option with a little bit of skin in the game. Meaning, okay, so there's a public, and I bet this would talk about The Big Short. This would short, The Big Short by Michael Lewis, that book about the
I know which one. Yeah. Uh-huh.
So this would be the ultimate Big Short against the insurance company. You short United, you short Aetna, and so forth. Because what would this do? It would be you have a little bit of skin in the game, meaning you pay a fraction, because there's no buyer-seller experience in healthcare. There's no okay, how much does that?
There's no choice. You're right. When you're sick, you're sick. You need healthcare. You don't get a chance to shop around.
Yeah, maybe emergency is excluded until adjudication, but you usually have I choose the public option, and then in the public option, I pay a fraction of the true costs in real time. Meaning that well, you want an ultrasound or a CAT scan? Well, gee, how much is that ultrasound? How much is that CAT scan? I wanted to do a study where I give half the patients monopoly money, half the patients not, and see if the people with monopoly money spend less. And meaning obviously it's not real money, but see if they when they have to make a psychological, it's like the psychology of money, and would they spend less if they knew it was like their own money? Meaning, like when you buy I'm looking at a TV right now. If I had to buy a TV and it cost $200, I'd say, yeah, that sounds decent. But if it costs $2,000 or $20,000, I said, no, I'm not doing that. So just have a little bit of buyer.
I agree with I agree with 90% of what you just said, but let me postulate something and see if I can take you there with me. I think there are. First of all, have you ever driven on that road, that new highway? Let's say between Houston and Tomball. Have you ever driven on that highway?
Yeah. Mm-hmm.
Okay. I want a highway you haven't driven on. Have you ever driven from here to Colorado? From Houston to Colorado?
No. No,
Great.
I haven't.
All right. You haven't, right? But you pay taxes every single time to the federal government. You pay your income taxes every year, correct?
Yeah, you got it. Yeah.
No, but you don't pay for that new road or the new resurfacing of the road from Houston to Colorado. You've never ridden on it, but you paid some of it. Here's the thing, that the reason I said that is the following. You made a mention about having skin in the game. I agree with you 100%. I want all our skin in the game to be something called our healthcare tax. And when we need it, we use it. When we don't, we don't. That's number one. Number two, I am not a doctor. You are. You know what best practices are. I don't. But you went to school to do that. Now, the thing about it is, you are an essential part of our society. In other words, given that everybody gets sick, we must have doctors. I think there are certain professions, etc., that don't belong in the public domain, the fee for service, the thing that can be, maybe we pay it, maybe we don't. You're either sick or you're not. So I don't, first of all, see why for a profession like doctors, we don't look and say, if you want to be a doctor and you pass a particular set of qualifications, we make sure that you are a doctor. You know, you don't have to pay $300,000, $400,000, $500,000 to become a doctor, which then forces you to have to charge people an inordinate amount of money so that they can get health care. I'm talking about a system here where we have to learn to divide the essentials from what has to go into the profit domain. So good. I think we should be able to get doctors that we pay a damn good salary to, and we also pay for their education. And thirdly, by the way, if you talk about not wanting mandates, right? I don't want mandates. I want taxes. I don't want to mandate a person to have to buy a private product like health insurance that somebody else profits from. I want all of us to pay skin in the game, if you want to call it that, our healthcare tax. And whoever needs healthcare gets healthcare. Because I tell you one thing, Brother John, if you decide that you wanted to use your freedom not to buy healthcare insurance, and you break your leg in the middle of the street and you're bleeding out, no humane person is going to let you bleed out because you chose not to have health insurance. We are going to take care of you. Nobody told you in order to pay taxes for that road between Houston and Colorado that you won't be able to use it because you didn't pay tax, because you did pay taxes that entitles you to every single federally funded highway in this country. So I think as well, we should all, yes, Eric, there is a healthcare tax called that 3% of your salary, but it's Medicare tax that you only get to use if you're disabled or if you're over 65 years old. So that's not quite what I'm talking about. I'm talking about every single American who works pays a tax in healthcare. They get a card that entitles them for good healthcare, basic healthcare. We determine as a society what we are going to call basic healthcare, meaning the minimum things that you're going to want. And if you want flowers in your room, if you want all kinds of niceties, you can have a complimentary insurance companies. If they think they can make a profit by giving you some additional service, by all means, you can buy a bells and whistles policy. But as a society, we should have basic healthcare that covers healthcare to allow you to live and survive from an illness. That's my opinion. That's what I think humane countries do around the world. I mean, if you take a look at Great Britain, the only thing that is screwing the Great Britain system right now is the introduction of privateers in the system, whereas it worked very well for decades. Now, slowly, they're allowing the capitalists, the privateers, to come in and suck like a parasite what Multiplan is doing out of this article that I just spoke about. Go ahead, John. Make a comment before I move on.
Yeah, thanks. I agree with 90%, 99, 95% of what you just said. Yeah, basic health care should be a right. But my only using the highway metaphor, I would have an option of a toll road, just like the Beltway.
I agree. I think so. Then we don't have a disagreement, my brother, because remember what I just said. I said we have basic healthcare that everybody uses, and what the bells and you can buy bells and whistles if you so desire. And insurance companies, if they want to provide a new service on top of basic health care, they can. But basic health care provided by our society. Go ahead, sir.
Yeah, we're in agreement. Meaning, the road you go on, but the traffic might be worse. I just took I-45 up to Dallas to see my son who's in school up there, and it's a fine road. Now if there was a Hove lane, as I paid more to go 90 miles an hour, if laws allowed it, then maybe I would choose to do that and pay the extra fee. And I do that all the time on the Beltway. So it's just the Beltway metaphor, and just have that as a free option, not a free option, a free to choose. I sound like Milton.
There you go. There you go, brother. There you go.
Yeah. So you let the market decide. And also regarding emergencies, we already have laws that protect patients. If they present to the emergency room, by law we have to treat them, and even admit them, and the hospitals eat the cost. And I did my general surgery at Cook County Hospital in Chicago, a safety net hospital. It's a big 1,000 bed at the time. It was a big 1,000-bed safety net hospital. So everyone got care there, and it was all on the tax. And also I trained in Massachusetts where we had Romney Care. There, everyone has insurance because of Romney Care, which is the predecessor of Obamacare.
Obamacare was just a souped-up Romney Care, and it's funny because Obamacare is again a bill. We didn't get the public option in Obamacare, but also we went ahead and followed that private model again, where we have parasites like the insurance companies and the multi-plans of the world that ultimately cost all of us more money. When people talk about Obamacare being expensive, they're right. And it's only expensive because we have the private sector involved. I mean, look, it's you just have to look at the profit statements from insurance companies and the profit statements from a multi-plan. Yeah. Look at the profit statements, folks. Yeah. That's your money. That's not these guys doing something miraculous. That's your money. A transfer of wealth.
The business model of insurance companies is to deny claim.
Yes.
Right? I mean, that's all insurance companies do. Now, the problem with President Obama had to deal with the insurance companies because of the lobby forces. So I understand. Right. I'm no expert.
No, you're correct. But I was involved deeply. Yes, that's what happened.
We should have had a public option, and that's what we deeply need. But how do we get from point A to point B? The grassroots. Maybe it takes a Republican to do it. Meaning, maybe it does. Maybe we just. I don't know.
The thing about it doesn't. The problem is that it. The reason we say maybe it takes a Republican to do it is that the fallacy is that whenever we talk about fiscal responsibility and not spending, the Republicans have sufficiently convinced Americans that that's what they stand for. The numbers doesn't say that. The numbers don't say they spend less. The numbers don't say that they are more efficient. The numbers say the exact opposite. But we are horrendous at marketing what we stand for. And by the way, when I say Republicans, I'm not talking about Republicans in name. I'm talking about neoliberal Democrats as well. All right. There's a very vast difference between what we have here. So neoliberal Democrats are no different than straight line Republicans. So, I mean, the reason we don't have good healthcare insurance, et cetera, right now is that, again, we have neoliberal Democrats. That's the basic. Yeah. That is a basic answer right there.
Okay, but anyway, here's my final pitch. Robert F. Kennedy Jr. I know we talked about that ad nauseum, but he, maybe he could get it done. And but he I know he's not going to get elected.
But he doesn't have a base either. The problem with Robert is we like Robert because he's not Biden and he's not Trump. The problem about it is you have to have. The one thing that Biden has is a litany of policies, and a lot of them are framed by Pramila Jayapal and others in the progressive movement. He had to adapt a lot of those things to get their support. Trump just have Trump. Trump is Trump. Trump is an entity onto his own right. So not Trump and not Biden is Kennedy. The thing about it is, if I ask you to do this, my brother, you query policy for policy. What? And I'm not going to ask you an answer now, but I ask you to do this. Query by Kennedy's policy for policy for policy. Figure out what is his base and what is the ability to get that done. And then let's talk about that some other time in the week. Is that okay?
Yeah. Of course. Lastly, I was just up visiting my son who's in college up in Dallas. And a chunk of his friends, and these are like, they're sort of upper middle class, they come from families with money. And a chunk of them are for Bobby Kennedy.
Yeah,
he has
I know.
Under my vote. That's his base.
Yes.
I don't know his base. Amongst
no. Actually, you're right. You're right.
I'm in my sixth decade, and I'm with these kids.
Well, look,
because I have a little a nostalgia for the Kennedy name.
Yeah, I know, brother, but you know what? We'll talk about that further. Let's look. Thank you for the call, and thank you for spending this time, Dr. John. You have a good one, okay?
Okay, thank you so much.
All right, let's go to Brian. Brian, are you going to be on this subject or something else, the healthcare subject?
No, we'll go ahead and talk about some of Biden's policies, such as the strategic oil reserves, how he nicely sold them off to part of it to China, part of it to India.
Okay.
That was a pretty good move, right?
Actually, at the time that he sold the reserve, I think it wasn't only a great move, it was an excellent move. And let me explain that for you, okay? I know it is easy to make. You asked the question, I'm about to answer it, Brian. All right? It was an excellent move to use the reserve because the reason for the reserve, for all practical purposes right now, for a country that can produce more oil than it can use, because unlike the fallacy out there, the best person so far this entire century for oil has been Biden. And I'm not saying that he did anything special. He just didn't do a damn thing, and the markets took over. All right. And the markets took over and allowed these guys to drill, baby, drill. So when you hear Trump talking, drill, baby, drill, the folks can't drill no more. They're drilling as much as they can right now. The United States is actually self-sufficient in producing oil. I'm not talking about the reserve. The reserve was additional oil. Okay, so here's the thing that you were being ripped off, Mr. Brian. You allowed the corporations to rip you off and fool you into believing something that wasn't true. Let's repeat. We are producing more oil in real time that we need. And at the same time, we have something called a reserve where we have hundreds of millions of barrels of oil stuck in caverns in Louisiana and other places. And at the same time, during an economic crisis, the parasites in the oil companies raised prices unjustifiably of oil. And Biden says, okay, I'm going to flood the market with some more oil that you've convinced Saudi Arabia to take off the market. And of course, we are sanctioning Venezuela from bringing that oil, which they are sitting on the largest reserve of oil on the planet. And so to mitigate the prices right now, I'm going to throw some more oil on the market because I have the power to help the people of the United States of America. And then we have Brian, my good friend, my brother Brian, calls in because he buys the crap that the oil companies are putting out and saying, oh, he's putting our country at risk. BS. Our country was never at risk with oil. It's all a political mumbo jumbo driven by the oil companies. And guess what, Mr. Brian? The numbers are there for all to see. And if you want to go over the numbers before you hyperventilate, my brother, we can talk. Your turn.
Okay. Oh, thank you. Pretty long-winded, but I'll go ahead and go over some numbers with you. 700 million barrels that Trump bought at about $20 or less per barrel. Biden sold it at $80 to $87 per barrel. Any of your listeners want to know what type of a profit that was and what happened to this profit? Where did it go? Now, I also am old enough to remember the oil embargo of 1973, right? How many days did the United States go without oil? That's why the strategic oil reserves were put in place.
Okay, stop right there. No, stop. Because we want to make sure our. No, you stop. No, Brian, stop. Because I want to make sure the American people who are listening to this show are. Stop again. Here's the thing. Listen to what Brian just said. We one of the things that people do on the right is they conflate things and not tell you the truth and I don't think he's doing this purposefully, because this is what the right wing says. So that's what he's regurgitating here. Listen to what he said. During the embargo, during the Carter years, we had days that we didn't get oil because there was an embargo. That is a true statement that Brian said. Here is the fallacy from Brian. At the time that occurred, America could not meet its own oil requirements in real time. In other words, we had to bring oil from overseas into America for our economy to continue, for them to drive. We do not have that problem anymore because we've drilled, baby, drill. So that argument that Brian just used right there is a false argument. There ain't no embargoes because there can't be an embargo, and there cannot be an embargo because we are producing more oil than we consume. Don't let the oil companies conflate things, folks. Continue. Continue, Brian.
Yeah. Wait a minute. What happened to the profit that Biden sold the 700 million barrels of oil?
Okay, stop. Okay, you ask a question. You stop. You okay, stop. Stop. Let's stop. No. Brian, I'm not going to let you do this, Brian. Brian, I always let you talk. I'm not going to let you confuse Americans. I won't do that. First of all, you're talking two separate issues. You're talking about the oil reserve being filled with $20 a barrel oil, and that's not true. First of all, wait a minute. Hold on. Again, that's not true. Let's get it straight. The oil reserve has been filled through many administrations at various different prices. So maybe some of it was made at $20 per barrel. But the reality is not all of it was at $20 a barrel. So that's a false statement. Okay, it's a false statement. Don't try to snow the American people. That's a false statement that the right wing is putting out there. If you're going to come on the program, my brother, I give you the chance to talk, and when you misinform and I correct, just go ahead and acquiesce to the correction. You are wrong. Okay, now that oil in the reserve was not all at $20 a barrel. And when Biden sold it, the fact that he sold it when the price of oil was high was the very smart move. Why? Because again, as Brian does point out, there was a profit made on selling the oil that goes right into the coffers of the Treasury, which mitigates the federal deficit. All this is accountable. All of this is accounting there. So when they hyperventilate and said, what happens to the profit? It goes into the general fund, and it then shows a lower federal deficit. Continue, Brian.
No, the oil reserve was not just filled under Trump. It was not filled during Katrina. Okay? It was not filled during Katrina, and it has been refilled since then. The United States was down to 14 days of petroleum reserves after Katrina because there was no production.
Brian, what is it that you don't... Brian, stop. What is it? Why are you lying to Americans? Why is it that you can't understand that? The reserves, sir. Yes, you are. You are lying, because the reserves, when you talk about there being 14 days of reserve, it's a truth that there at some point you have X amount of days of reserve. But what you're missing is that right now, And for the foreseeable future, we are the reserves are made to bring in, to cover for oil that we can't import because of some shock. Okay. But the problem here is those were times when we didn't have an oil industry in America that produced enough oil for America. What is it that you don't understand, that we are drilling and producing more oil than we are using? What is it which means the reserve is just there? And that the move that Biden made to force the oil companies to stop stiffing Americans made sense. It is that simple. It's an economic decision that was the perfect decision to make. And to try to change it doesn't make any. So look, I got to go to Art now, Brian. But let me just tell you, I love you, brother, but you're wrong, and you're back. And you're wait, hold on. Listen, Brian, you are wrong, and Brian, you are wrong. In fact, Saudi Arabia cut during the pandemic. After the pandemic, when the price of oil started to go down, what Saudi Arabia did was to cut by 2 million barrels a day, even though there was a war in Russia that they claim would have affected the price of oil. Saudi Arabia cut prices. It tells you that the oil market, including what the American companies do, is a cartel to screw you. And they lie to you. You can't cut 2 million barrels of oil if there's a shortage in the market. Let's go to Art. Brian, I'm sorry. I'm not going to let you lie to the American people. Let's go to Art. You're not going to, my brother, you're not going to lie to the American people on the oil issue. The numbers are there. All Americans that are listening to me right now, all people around the world that are listening to me right now, the oil numbers are there for all to see. The oil companies and the people who have instructed or perverted the minds of my brother Brian, they are betting on you not doing your own research. But numbers don't lie. Saudi Arabia cut by 2 million barrels a day of oil. Even as there is a war in Russia that we claim would cause an oil crisis, even as the largest country in the world, the largest reserve in the world, for all practical purposes, is offline. That's Venezuela. And also, we, the American people, we produce more than 100% of the oil that we need in the aggregate. We cannot, the price of oil right now at $90 a barrel is a ripoff to you and me because they have pricing power, because they can. And what they do is they create false scarcity. False scarcity means they simply hold back on putting oil on the market to make sure that you think there's a shortage. The numbers are there, people. You can look it up yourself. But they assume that you will just listen to what the CNBC or Fox News or OAN are telling you. Don't fall for it. The same thing happens in healthcare. We have to take the bull by the horns and protect our own financial security, because their model is simply to make as much as they can, and that means you pay. Let's go to Art.
You okay?
Art, you're on. Yes, sir.
All right. Cool. It'd be good to let Brian had a good point. But I know you may not believe it to be true. There's a lot of people who
No, wait. What point? Please tell me what point that he had, sir.
Well, you barely let him finish, so I think that would have been a good start. But that's not what.
No, sir, he did. Wait, sir. No. I'm not going to let you get away with that, my brother. I'm not going to let you get away. I let everybody speak, but if you start repeating yourself and you start telling a lie, it is not fair to the American people. So go ahead, make your point.
Sure. Yeah. So back on Robert F. Kennedy. Yeah, he has a lot of policies and platforms, and you can go to 24.com, Kennedy24.com.
I did.
Everything is there, and I know how you are. You're gonna, pick and choose what to. But he has a great stance. And if the national Democrats and the national Republicans would stop working together to keep him off the ballot, I think he would have a serious chance. If they really believe, mostly the Democrats would believe, and go back to the basics of one man, one vote, and allow this, candidate to be on the ballot, where he doesn't have to fight so much to get on different ballots, he would have a shot. He would have a serious shot because people are.
When did we ever have one man, one vote, sir? I don't know what country you're talking about, but we've never had one man, one vote. And by the way, I would love a choice other than Biden and Trump. But again, like I said, I as a responsible host, my job is to tell the truth, and the truth is. Kennedy had
allow our airways. If you're going to allow us to keep our airways, then you have to, as a host, hear different points and not get triggered.
Yes, I do.
That's what I'm. Yeah. So, anyway, so yeah, I mean, he has different points. Everybody, do your own research. You can watch his long form interviews on different podcasts, and yeah, people are tired of Trump, tired of Biden. I don't care what side you're on.
Art. I got to go to Patrick now. Thank you. Let's go to Patrick. Thank you, Art. I got to go to Patrick. Patrick, you only got 35 seconds. Sorry, man.
It's fine. I just wanted to mention that Brian's probably on that point because Trump said something about Biden selling oil, but Trump did the same thing. He sold oil to China in 2017. He just left that out of his rant. All right. Have a good day.
Thank you, my brother. Go ahead, studio. We're about to end the show. Come on in.
Yes, sir. We are right here. And Jack, what you got for us today?
Vampires, vultures, and icks. Oh my.
Well,
thank you,
something.
I just want to close out here because, I had to interrupt Brian because we can't look, I want everybody to have their say. Absolutely. But we can't allow the fallacies that are numerically provably wrong to get out there and get a leg on its own. We just can't have that. We've had that for too many darn years from the mainstream media. Anyway, we'll continue this tomorrow. My name is Egberto Willies. I love you all. Thank you all for being here. My name is Egberto Willies. This is Politics and Right. And you guys know how I end this baby. I am what? Out.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number 1, subscribe to our channel. And number 2, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.